My name is Mika. I'm here to actually talk about the health and happiness study. But before I do that, I just want to say thank you again to Karen and to WOHASU for hosting us and for organizing this incredibly impressive, inspiring summit. It's been a very impressive day. It's a little bit intimidating to stand up here in front of all of you and try to tell you something you don't already know about happiness and well-being. So instead, I think I'll start by talking about something I do know a lot about, myself. So as I said, my name is Mika. I am a PhD candidate in public policy at the Harvard Kennedy School. What that means is I basically spend a lot of time behind computer screens in dimly lit rooms looking at data sets, not a lot of time in the public eye. I think probably the last time I gave a speech to an audience even resembling this size was back at my high school graduation. And back then I was fortunate enough to go to a pretty good high school. I went to an Ivy League school for college where I learned the value of hard work, probably overlearned the value of hard work. I think maybe the key takeaway from that experience was that what I would do in the world, what I would accomplish, my success, that was really what was going to make me happy. That's what it meant to live a good life. But as I made it through college and graduated and started to see a lot of my friends and peers take jobs that didn't seem to be contributing to their happiness but detracting from it, I started to question this relationship between success and achievement and happiness. And so I did what any existentially confused 20-something in my position would do. I packed up my bags and I moved to Amsterdam. And in Amsterdam, I was confronted with an absurdly tall group of very friendly, funny-speaking people who all seemed to be a lot happier than anyone I knew back home. And this puzzled me a lot, and I really wanted to learn more about this. I first wanted to make sure I wasn't totally crazy, so I started to look to see, can we measure happiness? Can we measure well-being? And it turns out, of course, we can. And well-being differences are not only measurable, but they're real across countries, across individuals, not just between the Netherlands and the United States. Here you're seeing a graph of the Cantrell ladder from the World Happiness Report for both countries, but also between individuals. And I wanted to find out why. What explained these differences that I was seeing and feeling in my life? So after spending a little bit more time in Amsterdam than I expected, about 7 years, I eventually found my way back to school to study happiness at Harvard, where I found myself in a seminar sitting next to Laura.
Hi everyone, I'm Laura, or Laura. I'm originally from Italy, and I'm a research associate at the Harvard School of Public Health and Boston Children's Hospital. But more importantly, I'm a young woman for a passion for science. And I used to spend a lot of time in this place in the north of Italy years ago during the summer with very few houses with my dad, who's not here anymore. He passed away 8 years ago. And that situation was very traumatic for me, and it happened during my unpaid internship in psychology. At that point, we talk about hope and meaning today. I was really thinking, why it's happening to me? What's the meaning of all of that? I need to have hope. And I put all my effort into science through my PhD in Switzerland. At that point, that my PhD supervisor, during the tough conversation that we used to have in the final year of our PhD, he asked me, Laura, do you want to go to Harvard? And my first thought was, is that even an option? Like, I'm just a young girl from the north of Italy, and my parents didn't have a university degree. Is that really possible? And he said, yes, you just need to write a grant, and if you get it, you go. And you can imagine how did it go, not only with one grant, but even other grants. And my focus at that point was that I really want to study health and happiness and what is important for us. And we know that part of that, we already talked a lot this morning, is social relationships. I wanted to focus on that not only because my dad used to tell me so, but also because we know from the longest study in human history, the Harvard Study of Adult Development, an 80 years plus long study, that the quality of our relationship is what matters for our happiness. And at that point, I found these amazing people to continue the study of health and well-being. Caspar.
Yeah, thank you. So I'm Caspar. I am a research fellow at the Wellbeing Research Center at the University of Oxford, and also a professor at Warwick Business School. And so my journey to well-being has been slightly different, yet again. I was initially sort of interested in it from a philosophical perspective. And so I decided, well, I should probably then go to Oxford, sort of the place to study philosophy, and try to find those answers. And when I did that, the answers were interesting, they were insightful, but they were also a little bit frustrating because you couldn't really get actionable insights from that. And so in that frustration, I really turned a little bit into a nerd and became more of a kind of happiness data scientist. And you can do quite a lot once you take that perspective. And you will have seen already quite a bit of those types of insights when you're taking this data science perspective. So let me just give you one more of those kinds of examples. You might have seen this kind of graph before. If not, I hope this is not news to you. This shows the relationship between household income in Europe and people's well-being. And essentially what you see is that once you're earning more than 75,000 euros per year annually in Europe, more money is not going to make you better off. Of course, this number will be higher for the United States, but I could imagine that at least maybe for the majority of you, this threshold already applies. So you can, of course, learn quite a lot more using this kind of approach, but we are, as a science, starting to hit a limit. In a recent study that we've published, we could show that only about 30% of human variability in well-being is explainable with the best data sets that we have available and the best kinds of methods that are available today. So that leaves 70% of the variability in human well-being completely unexplored. And with this study, we want to tackle those remaining 70%. And I think Mika can say more about that.
Thanks. Yeah, so one of the reasons why we still have this gap in what we understand about well-being is the data that we work with is often collected from large samples of people maybe once per year asking these big questions about how they feel about their lives in general and life meaning. And these questions are incredibly important and incredibly valuable. But we wanted to find out what if we could get much more detailed. What if we could ask people not just once a year, but ask them multiple times a day how they're feeling, how their life is going? And what if we could match this data with data that was routinely collected already from smartphones and smartwatches to try to reveal hidden determinants of happiness in day-to-day life? And so we've partnered up with Garmin and Avicenna to develop an app to do this, and now with WOHASU. And we launched a pilot study at the Lugano Happiness Forum over the summer, and so we've already started to see some data come in. And one of the things we've been looking at are what types of activities are most associated with well-being in day-to-day life. So maybe I'll throw that out to the audience. What do you think are the activities that are most associated with happiness? Eating together, there we go.
Exercise.
Spending time with friends, spending time with family, that's great. Sleep, yeah. Sex, love that. So yes, all of these are important. I noticed nobody said work. That is actually the activity we find to be most associated with unhappiness. But the activity most associated with happiness is what we're all doing right now, cultural activities. Sitting in an audience, participating, sharing ideas, eating together. At least in the pilot studies we've done so far, that's the most important predictor. And we've also started to see some really interesting signs that data that is collected by smartwatches and smartphones, our step count, our sleep, and our resting heart rate in particular, are also really important predictors of happiness on a day-to-day life. But so far, we've just done a couple of pilot studies. We've been working with a small sample of about 200 people, and we have a goal to try to get 10,000 people around the world to participate in the largest study of this kind. And that's why we're here today.
So if you want to join the first study of this kind on health and happiness, we invite you all to scan this QR code here. You just need your smartphone to participate in the study. So you can do that even if you don't have a Garmin wearable device. And we ask you to invite 3 of your friends to join the study today. And you can copy and paste in the group chat. And we really ask you to help us to make this change.
And one final bit. What's in it for you? You might ask yourself. Well, 3 things. First thing, the warm glow of helping us and helping science. That's pretty nice. You're also going to get some discounts on Garmin devices, so that's pretty great too. And the third thing, and that's one that I'm particularly proud of, because I programmed those, are sort of personalized well-being reports that will tell you sort of which activities for you personally were really good for your well-being and which kinds of environments might have been more stressful for you. And all those kinds of information will be sort of supplied to you in a personalized fashion. And I think you would quite like it. Thank you.
Thank you.
Thank you.